All right, webinar is started and recording has started, and attendees are joining. Hello, everyone. We're going to take a few minutes to let everybody come in and take a seat, virtually, of course. And we will start in about 3 or 4 minutes. See a bunch of familiar fames. There's good old Herschel Chomsky from Perth Amboy. Is everybody ready for the remnants of the tropical storm or hurricane or whatever that we're supposed to get tonight? I'm just happy in my gardens. I don't have to water my gardens today, so.
Didn't know we were supposed to.
Yeah, overnight. I don't know about down by you guys, but up by me, it's supposed to get pretty significant rains, just like from dusk till dawn, basically.
Oh.
And yeah.
Oh, yep, I see what you mean.
Yeah.
Yeah. Welcome, everyone. I'm glad you're joining us this morning. With Jeannie and Nayeli and Bob, we'll have a good conversation.
Yep. Yeah, and as soon as this is done, of course, like I always do, I'll put it on the State Library YouTube. And Jeannie and Nayeli, do you want me to send you the link to that, or do you just want it to go to librarians?
Both work for me, and
Okay.
I can send you my PowerPoint as well, so that you can, Yep.
We can put it on our website. Sounds good. Excellent. Yeah. People often ask for that. And thank you for volunteering to do that. 1 second. Sorry, I had a problem in the library behind me. Okay, so we have some people here. I think it's time to get started. Hello and welcome to Promoting Public Health with the New Jersey Department of Health. I am your host, Bob Keith, and I'm joined today by Jeannie Davis. Say hi, Jeannie.
Good morning.
Nayeli Salazar de Noguera, and State Librarian Jen Nelson, who I have in my notes will be joining us later, but is not actually joining us later. She's here right now, so that's great. As always with Zooms that we do, there will be a Q&A session at the end of this presentation. Please, as the presentation is going on, use the Q&A button at the bottom of the screen to enter your questions into the Q&A window. It's just easier for us to manage that way, what questions have been answered or not answered yet. It's a lot easier than just putting them in the chat. The chat we usually reserve for if someone's having a problem with their audio or video, or if we need to put a link out to everyone or something like that, we'll put it in the chat. We try to keep that for that and the questions in the Q&A. So we appreciate you helping out with that. With that, I am going to introduce our speakers for today. So first off, we have Nayeli Salazar de Noguera, the Program Outreach Manager for the New Jersey Department of Health. She heads the COVID Community Corps, an initiative to increase public confidence in and uptake of COVID-19 vaccines in underserved communities across New Jersey. Mrs. Salazar de Noguera is also a doctorate student at Rutgers, the State University of New Jersey, studying urban health systems with a focus on Latino acculturation and mental health. She holds a master's degree in translation and interpretation in Spanish and English from La Universidad Autónoma de Guadalajara in Mexico, and a Bachelor of Arts from Rutgers University. Nayeli has functioned as project specialist for the US Senate, consultant to the government of Puebla, Mexico, consultant to the Mexican General Consulate in New York City, senior executive associate for the Dean of Rutgers School of Nursing, and a state fellow for New Jersey's Office of Communications. Nayeli was born in Mexico City and currently resides in Newark, New Jersey. And her resume makes me feel like I wasted my life. She's so accomplished. And after Nayeli speaks, we'll have Jeannie Davis, who's the program manager for the New Jersey Department of Health, Office of Population Health, focused on COVID mitigation and social support for vulnerable populations, such as persons experiencing homelessness, survivors of domestic violence, tribal nations, and individuals in county jails. She is the lead on the Library Community Empowerment Project that will support community empowerment through the establishment of educational hubs in local libraries across the state. Ms. Davis has over 15 years in local government and developed the Trenton Youth WIN, stands for What I Need, a mobile resource application for youth at risk and/or experiencing homelessness in the Trenton-Mercer region with OCLA. She holds a Bachelor of Arts from William Patterson University of New Jersey. And with that, we'll turn it over to Nayeli for her presentation.
Sure. Good morning, everybody. I hope everybody's well. I'm always interested in seeing if anybody will show up on video. Anywho, here's me, and I'm going to be sharing my screen today to really do this presentation. Feel free to share your comments in the chat box, and then we'll also be doing a Q&A at the end of our presentation. So let me put you down here. Okay, so the COVID Community Corps. Essentially, the COVID Community Corps began back in February as an initiative to again increase the public confidence of the vaccination uptake in really hard to reach populations in New Jersey. So here we see that here is a progress in terms of vaccination by Hispanic, Latino population, other race ethnicities. So the idea behind the COVID Community Corps was to really reach out to these communities virtually from in the winter months of beginning of this year until May or so. And then when we got to May, when the weather changed, we began doing physical outreach. So we started canvassing, being the boots on the ground into these communities. You'll see some of us knocking door to door. You'll see us in high traffic areas. And now we're starting a new initiative where we're going into malls and really talking to parents and children and engaging with them as they're doing back to school shopping. Again, with the understanding that we're just there as informants and letting people know the vaccines are available to them, and really the best way to protect yourself against variants, as we're seeing now with the Delta variant, is really through vaccination, not only for yourself, protection for yourself, but also for your family, your households, communities, and even schools now, right? So here you see, again, the COVID Community Corps is focused on minority populations, hard to reach populations. So among Hispanics, we're really reaching out to immigrant groups, individuals who are non-English speakers, and people who may not have who may be undocumented residing in the US and may not know how to navigate the health system. And in terms of African American and Black communities, again, it's the same groups, right? We're not only dealing with minority groups, but we're also dealing with the immigrant groups, especially in different sections in New Jersey. So you'll see, for example, in Essex County, we do a lot of work with the Haitian community. We'll do a lot of work with African communities in the Oranges and so forth. So again, it's really being those outreach workers, those trusted members, boots on the grounds, letting people know what's happening in terms of COVID, and then referring them to the system that is, in terms of vaccination, that is closest to them, whether it's a pop-up clinic whether it's a static clinic, such as a federally qualified health center, a hospital, a Walgreens, or even just talking to them and understanding what's happening in their mind in terms of hesitancy. So we're there really just to be trusted members, to have visibility and educate individuals. So again, here's an overview of what the COVID Community Corps is. So again, back in February, we started doing a lot of these virtual series of Let's Get Vaccinated. So it was back then, as you may recall, it was, there was limited amount of vaccinations available, and it was coming in by cohort. So eligibility came in cohorts. So back then, a lot of the work we did was virtually using social media platforms, using radio, localized radio stations, getting to working directly with nonprofits, FBOs, and letting them know what was available in terms of vaccination availability in their local area. So we worked with them, but at the same time, we were also recruiting for individuals who might be interested in being boots on the ground. So over the summer months, we were able to get on the ground and really talk to individuals in alignment with pop-up events and mega centers. We were there canvassing, but also even hitting the streets if there was no vaccination event, and just talking into individuals. So our members really were a wide range of volunteers that came from the public sector, that came from the private sector, students, mothers, individuals who really had a direct experience with COVID-19. A lot of the individuals that we spoke to were really passionate about getting this vaccine out because they had seen somebody in their family have severe illness, were hospitalized or even pass away. So a lot of our community members are really doing this out of the goodness of their heart, and even getting in there and talking about how COVID has impacted their life and why it's so necessary to get vaccinated. So to become a CCC member, you really just have to be 18 years or older, someone who is interested in public or population health, community outreach, and COVID-19 education. But today I really want to talk about how we as the Department of Health can really benefit from your libraries as partners for education. So again, our outreach approach is really three-pronged. We have education, navigation, and activation. Education comes from those series of education videos that we have online that are available to the public. We have them in different languages as well, depending on your needs. But again, it's really the series of Let's Get Vaccinated and knowing why to get vaccinated, the differences in the vaccines, and how to navigate your health system, whether it's online or in person, to get the vaccine that you want, right? And then in terms of navigation, again, it's really talking to individuals. Not only are we talking about vaccines, but we're also talking to individuals about really, I guess in a way, building healthy communities, and really tapping into preventative healthcare measures, and even social support systems and social services that might be available or of interest to those individuals who are having issues in that sense. And then in terms of activation, it's really getting into the ground and talking to people about what's making them hesitant. What would it take for them to get vaccinated? Is it time? Is it, the availability of a certain vaccine in the local area? Is it more education? Is it more, understanding of what the virus is and how it can impact you long-term, short-term? So there's a series of hesitancy, even related to religion and so forth. So what we want here is, again, to really understand our communities and know why there's such a low turnout in terms of vaccination. And obviously we know that a lot of the hesitancy comes from rooted historical events that might have happened for certain communities. But at the same time, we definitely want them to know that the vaccine is really here to assist them and help them to, at some point, just really stay alive at this point, right? And have that protection of not getting into that severe or hospitalization stage. So the role of the COVID Community Corps is, again, to share COVID information, assist individuals along the vaccine journey. And really, this is really where the bilingual outreach worker, people who resemble and represent the communities that we're trying to reach come into play, because we know the messenger and that trusted builds trust, right? So we want individuals who are from the community, that may look like the community, that speak the language of the community, to go out and do this type of work. And then in terms of track user experience, we want to know what's happening. So it's this ongoing communication between the outreach worker and the Department of Health, where we're learning and pivoting depending on what we're hearing on the ground. And then conduct proactive outreach. A lot of this is, building partnerships, knowing how communities behave. So it's behavioral health, understanding how people move, where they're going. So we've gone into libraries in the past virtually. We've also gone into laundromats. We've also gone into ShopRites. Where people go is where we want to be. And just having an opportunity, obviously, to just engage with them and not being forceful, but just be there, accessible and visible, so they know that the Department of Health is there to assist. And then here are some of the methods and locations where we've conducted our outreach. So we have a phone bank. We obviously work directly with the call center with the Department of Health, but our COVID Community Corps also has an arm that does phone banking, emails, social media, face-to-face, printed materials. We print so many flyers on a weekly basis and get it to our outreach workers, so they can get that information to individuals the same week and answer any questions that might be related to the vaccines, or in terms of registration. A lot of people don't even know that you can go in and get a vaccine for free, and and that's been the marketing since the beginning. And it's just interesting to know that that information might not be getting to some communities. And then in terms of locations, we obviously work with points of dispensing, such as hospitals, federally qualified health centers, pop-up events, community offices or houses of worship. So this Sunday, I'm actually going into New Brunswick and making announcements about the vaccine on Sunday masses. So I'll be there 3 masses, 10, 12, and 7, to make sure that information is getting to those communities. And then local health departments, obviously food kitchens. We've been working a lot with food kitchens and also food pantries and getting that information to individuals. Grocery stores, like I said, we've done vaccination events at ShopRites and so forth, and public transits. So we will, we know that our communities use public transit, and we are there even early in the morning trying to get people that information before they go to work. And obviously one of the locations we want to include here is libraries, because we know libraries are an information resource and station where people will come in during the school year. And those are safe places, neutral places, information that we know, places that we know that information is trusted, and we really want to partner up with you. And then, so let me move this down a little bit. I apologize. So how can libraries participate in in community outreach? We're not asking for you to canvas, but instead allow us to create these resource tables within your facilities. And what does that mean? That means really to raise awareness, have information there, have our community outreach workers, talk to people, just be present again to answer any questions related to COVID-19. Obviously, the spreading the word, just educating and just listening really sometimes to what people are saying. And, that really allows to build confidence, but it also sometimes will motivate people to go get vaccinated, right? And host education sessions. So right now we have several grantees, nonprofits who were awarded money, and what they will be doing is basically coming in and doing education sessions related to COVID-19. And we hope that we can, the libraries will allow us to come in and do those types of education forums for individuals who are particularly non-English speakers. And the other thing too is you as a librarian, as a staff member, can become a volunteer. And that's really what we hope for, is that someone in your facility will become the lead person for this COVID community outreach in your site. So again, really just being that facilitator between the Department of Health and our outreach workers in your location. And again, this is just kind of some ways that you can assist us, become a volunteer, help us share information through your social media, help us post and distribute flyers on site related to vaccination centers that might be in your local area, and hold materials for in-person information, and obviously those resource stations. So the way I envision this is really just having a station, really a table where all this material is constantly being updated as we're getting updates within the Department of Health and the CDC. So we just want to make sure that information is up to date and that there's always somebody there to answer questions for parents and children, right? And then again, the idea is just to really have these resource stations available on your hours of operation. So why should you join the course? We have it here. We know that in the coming months, it's really going to be back to school. It's going to be people who are immune compromised. It's going to be pregnant women. And so those are kind of the focus groups that we want to do in the coming months. But, the general public will also be, I think they made an announcement yesterday, I have to double check, but will be eligible for booster shots. So I know there's going to be a lot of questions, and I know that the questions might be coming to you, and we just want to be ready and really partner with you so that we have that information on site, for our communities. So we really appreciate your time. And if you have any questions, please share them in the chat now, or you can always email me at nayeli.salazar@doh.nj.gov. We also have a website, we have a website, but we also have a Facebook where we're constantly posting up pictures of our activities across the state. I mean, we cover the whole state, and there are 10 counties that, are where it's kind of like our focus for the next coming months. But I assume that they're going to be changing again, especially with the booster shots. So more to come. If you have any questions, like I said, please share them in the chat or email me. Thank you.
Thank you so much, Nayeli. That was very informative. A lot of stuff to think about, I'm sure, for all of our librarians attending. So I think we're going to move on to Jeannie's portion, right? You are muted, just so you know. There you go.
Thank you, Bob.
You're welcome.
Also, thank you, Nayeli, for sharing that incredible PowerPoint presentation. And just to echo what Nayeli said, the state has been very fierce and driven to the commitment of health equity and data transparency, and just thriving partnerships to continue to keep our state healthy. And we recently received some funding from the CDC to address COVID-19 public health disparities among populations at high risk and underserved, including racial and ethnic minority populations, our transient populations, and rural communities. And with this funding, DOH proposes activities across several strategies. We want to be able to continue to build our resources and services in our communities, data and reporting, infrastructure and support, and partnership mobilization. We truly believe that the infrastructures that currently exist in our libraries are our trusted resources. It's the place where we go where we don't have to spend a lot of time to demystify information, because we know that it's going to be true. We know that our libraries are only going to have the most current and up-to-date information, and we want to be able to support that. We want to continue to have this information available in our libraries so that as we experience future pandemics and other events, our community is prepared, and they know where they can get that trusted information from, and it's our libraries. So with this funding, we're building out what's called the Library Community Empowerment Project. And the goal is to mobilize partners and collaborators to advance health equity and address social determinants of health as they relate to COVID-19, health disparities among populations at higher risk and that are underserved. So there is so much innovation and creativity in this space, where with this funding, a library in either the northern, southern, or central region, there'll be 2 libraries selected for each region. And they would have an opportunity to develop a community empowerment section, a section that is health related, where they can host webinars similar to this one, but for the community, to discuss all of these special health topics, to continue to get information out. Similar to what Nayeli presented, just making sure that the community is aware of what testing opportunities are and vaccine opportunities. And beyond that, as we move into the flu season or just childhood vaccinations, so how we can continue to make information available to our community. Also knowing that a lot of our transient populations go to the library because that is a safe haven. That's somewhere where they feel safe, where they'll have access to the internet, where they know that their librarian is a trusted person, and that's someone who is consistent. So the libraries have gone from just being a trusted resource to family. So we want to be able to encourage our libraries to apply for this funding. And it's an incredible pilot program, so I'm really excited about sharing it. We did release the first round this past July. A second round will become available soon. The date hasn't been made available yet, but once it becomes available, I'll be able to share the NOFA with Jennifer. With Jen, and she'll be able to share with the libraries. And we encourage all of our libraries to apply. If you are not familiar with the state's SAGE system, because you can only apply for this funding through SAGE, I deeply encourage you to, I'll drop a link in the chat box to start that process, because it takes a few days, just so that you'll be able to sort of review what kind of grant opportunities are there. I believe the opportunity that was just released in July will still be there. You can review it. If you have questions, there's an email box that we're still checking. You can ask questions there. But there is so much flexibility and creativity there that we want to be able to support our libraries, because our libraries support our communities, and we want all of the real information, the true information, to go into that space so that our community can be as resource rich as possible. So, at minimum, the funding is $100,000. So, at maximum, the funding is $100,000. So we're really hoping to get 6 really strong libraries who are ready to continue to dive into this work with us to support our communities. Thank you.
Thank you very much, Jeannie. Again, great information. We have a couple of questions in the Q&A. I've seen there's been a lot of stuff going on in the chat. And when I post this video on YouTube, I will try to put the chat transcript in the description of the video so that people that view it can have all the links and email addresses and things like that. I was going to actually ask, while we're answering these couple of questions, if Nayeli wouldn't mind sharing her screen with that last slide that had your contact information on it. Maybe that might be helpful for people to have that up so they could copy it down while they're listening to us, or to the two of you. I'm not going to be answering these questions. Listening to you answer these questions. So first question from Luis Rodriguez asks, how detailed are your statistics by geography, age, etc.? If at the municipal level, this will help my health department and partners to figure out who to try to get to attend a vaccine clinic. So I think he's asking about like the granularity and the locality of your statistics as far as vaccine reluctance and in different groups and things like that.
Yep. So what we did was I did send out the website. It's covid19.nj.gov. So on that website, if you scroll all the way down, and I think I answered it, but if you scroll all the way down, you'll be able to, actually, let me just show you since I'm sharing my screen. So again, any information that's related to COVID-19, you can find in our COVID-19 information hub. So the address again is covid19.nj.gov. If you scroll all the way down, you'll be
I think
able
you might have to
find-
change the window that you're sharing, Nayeli, because we just see the PowerPoint. Yeah, just reshare it.
Screen share. Okay. Can you see
Perfect.
this now? Okay.
Yep.
COVID19.nj.gov. Scroll all the way down. You'll be able to see basically our vaccination overview, cases, mortality, hospitalization rate, cases by municipality. All you would have to do is click on here, and then you can filter it the way you want to. So it goes by county. You can also do it by municipality. I believe it's just cases that you can see by municipality right now. But if there are specific questions related to a municipality or a particular county, you can always contact me and I can try to find the most up-to-date information for you. We can't find it here.
Great.
And then
Thank you very much. Oh, sorry.
Sorry. Since I'm here, I'm just going to quickly show you on the same page. If you go to vaccine information, you can find vaccine appointments in your local area just by clicking and then putting in your zip code. And you can even, filter it out by the miles that you wish to travel, in addition to zip code. So all the information is really here. And I know it's a lot and people get frustrated, but this is just one avenue, right? Obviously, we're walking around and letting people know of a pop-up event that might be happening in this weekend. And then the other thing too that I wanted to mention, obviously we have our scheduling system through NJVSS. We have our number that's a senior hotline, and we also have our regular phone call center. And all the information is here. You might just have to scroll down a little bit, but you'll also find our COVID Community Core website. So here you'll be able to sign up for the COVID Community Core, take on the online training, and then sign up for volunteer opportunities if that's what you want to do in terms of going out and canvassing. But all our forms and documentation and outreach material can be found directly here. So we've tried to centralize everything so that it's organized for the general public.
Excellent. Thank you very much. All right, next question is, what is the grant name that Jeannie talked about? Do you have the link? I don't know if that's what you've been posting in the chat, Jeannie. Did you, the SAGE system, or is that something different that they're asking about?
Okay, so the link is so that they can register to get access to SAGE. So they have to register as a vendor in the state system, and then it'll transfer over so they can get credentials for SAGE, which is the grant management system. And the grant is called the New Jersey Health Equity Response to COVID-19, and it's activity C3. I can also add that to the chat.
That would be great. Thank you so much.
You're welcome.
Okay. And the last question we have here is, are there ways to get information or support for questions from non-English language speakers?
Yep, absolutely. So the best way is to actually calling our call center, and I'll give you the number here, and I'll also post it on the chat. The number is 855-568-0545, and that's the general line for questions related to COVID-19. We have over 240 languages. Agents that speak over 240 languages, and anything related to COVID, the vaccine, or just registering, or if you just want to look for other information such as support system information, so forth, those agents will be able to refer you in your language. If they are Spanish speaker, the agents, they'll work directly with an interpreting service to get that information to you. So there's always someone on call, and that line's available 7 days a week from 8 a.m. to 8 p.m. And I
Okay,
apologize, someone's doing construction upstairs.
That's all right. Louise also asked, can we give that number to patrons, to library patrons?
Yes, anyone can use that number.
Great. Excellent. All right. I don't see any other questions in the Q&A. If you have any questions, speak now or forever hold your peace.
While we're
Yes.
waiting on some additional questions, this is Jen from the State Library. Just want to plug a new resource that the State Library is making available to libraries. It's a homeless training institute that's done by Brian Dowd. It's available as an online tool, and it has some really wonderful training for helping us as a community to work with folks who are homeless or who have other challenges. So it's really a great training. We're pleased to be able to make it available at no charge to all New Jersey libraries. That's school, public, and academic. So if you're interested in that, it was in our last newsletter, and you could also email me or Kathleen Moeller-Pfeiffer for more information about registering for it. I just wanted to put in a plug for that.
That's great. Excellent. One last question. When will the recording be posted on YouTube? It will be posted on YouTube by the end of the day. I will do it as quickly as possible and get it out there. And I will post the link on NJ Pub Libs, our directors listserv, and put it, give it to our marketing department for inclusion in our NJSL Direct newsletter. With that, I think we're done with questions. Jen, would you like to play us out?
Sure. Happy to. Thank you all for coming and joining us today. It's important as a COVID community response that libraries are part of the solution. We have been all along, but let's raise our visibility a little bit and really take advantage of the fact that we have are known as solid sources of information, particularly when there's a lot of mis and disinformation out there. So I hope that you're able to take advantage of the resources that Jeannie and Nayeli have shared. I would say I've worked with Jeannie and Nayeli both, and they're terrific people to work with, really responsive. So don't hesitate to reach out if there's something you're still questioning or not sure about. They will be responsive and help you out. And keep us in mind if you are doing some work in this area. We'd love to publicize it through our newsletters and through the channels that we have. So don't be afraid and don't be shy to drop us a note and let us know that you're doing some work, and we'll get the word out to be a role model for other libraries. And with that, I will say thank you, and thank you to our presenters, Jeannie and Nayeli, and Bob for being a host with the most. And we hope to see and hear from you soon. Thank you.
Thank you,
Thank you
everyone.
very much.
Thank you.